In this video, we are going to share with you an overview of electrochemotherapy and its benefits to the patients. The images we are going to share with you might be disturbing to you, but it is only after understanding the agony of the patients one can appreciate their needs.
Tumors that you are now seeing on your screen are late detection head and neck cancer tumors. These stubborn tumors are often non-responsive to regular treatment modalities. They are recurrent and extremely painful. Constant bleeding and secretions make their management difficult. Their size and location hinder functions like breathing, eating, and speaking, leaving the patients in great agony. Electrochemotherapy is an advanced treatment modality for the management of such tumors. It is a combination of low-dose chemotherapy and short-duration electric impulses. It is applied locally to cutaneous and subcutaneous tumors. It requires application of multiple impulses at tumor site. A tumor can be treated multiple times. Short-duration electric impulses of a specific voltage increase cancer cell membrane permeability exponentially. This allows for a very high uptake of the chemotherapeutic drug. The change of permeability is transient and reverses when impulses are stopped. The trapped cytotoxic drug impacts the cell, resulting in cell death. The treatment achieves tumor healing, tumor regression, and control of tumor pain, bleeding, and secretions. The drug dose for the therapy is low and hence side effects are negligible. World over, various studies on electrochemotherapy have reported good percentage of success. In India, electrochemotherapy has a very useful application as head and neck cancers constitute 30% of all cancers. However, high cost of treatment has been a major hindrance in accessing this treatment.
In India, electrochemotherapy is mainly used for treatment of head and neck cancer patients. These patients come from economically weaker section of the society. In order to reduce the treatment cost, this electrochemotherapy device is totally indigenously developed and designed so that the treatment is now more affordable. Electrochemotherapy is now worldwide accepted therapy. We have made some improvements in efficacy and safety of this device.
The Permeos electrochemotherapy system comes with several unique features. Its applicator has a novel locking system. Locking ensures that electrodes fit firmly into the applicator. Permeos provides for a user-friendly software app which captures patient and treatment information. It stores tumor images.
We have been running the phase 1 trial on electrochemotherapy. We have accrued 12 patients. What we have seen so far that it is quite safe in well-selected patients. There are very minimal side effects for this therapy. And in some patients, though we have not analyzed the results yet, what our experience has been is that for small recurrences or ulcerative lesions, electrochemotherapy works very well. It causes decrease in the pain, it causes decrease in the swelling, sometimes decrease in the bleeding, and improves quality of life. We intend to further accrue more patients to the tune of 30 patients. We are trying to do it in breast cancer as well. Those who have local recurrent diseases, we are currently looking at these subset of patients.
Understanding the need for financial support enabled this new technology to reach the needy head and neck cancer patients. The Rotary Club of Pune Pride, in collaboration with Rotary International and Rotary Club of Lake Nona Lunch, USA, has donated the indigenously developed Permeos electrochemotherapy equipment to 4 cancer hospitals in Western India through Global Grant number 2128931.
Rotary Club of Pune Pride has initiated a global grant for electrochemotherapy devices to be donated to various cancer hospitals. This is very important, which will help the weaker section of society to get advanced tumor treatment.
The Rotary grant is based on the principal donation by Trident International Private Limited.
As a part of our CSR initiative, we were looking to identify projects that would be impactful and most importantly benefit those most in need. So when I heard about the ECT device to treat head and neck cancers that was being developed indigenously, I was very interested. As I researched more, I learned some bone-chilling facts. India has 30% of all head and neck cancer patients. More than half the patients present themselves with advanced disease, and many of them are poor. So this checked all the boxes. More than anything else, it provides a sliver of hope when it's most needed.
Our patients, 40% of them are from head and neck region, and significant number of them come in advanced stage. We cannot give them a good result of our treatment because of this advanced stage. Electrochemotherapy is now available in our institute. With this therapy, now we can reduce the size of the tumor so that the tumor which was inoperable can become operable. The best results will be in a locally recurrent disease, and if the disease is small, we can even cure it without surgery. If the disease is big, we can reduce the size of the disease. We can reduce the pain of the patient, we can reduce the bleeding from the lesion, and in this way we can offer them palliative treatment.
Chemotherapy is a very good option for the patient with head and neck malignancies, particularly advanced head and neck malignancies. We give electrochemotherapy to these patients and they get symptomatic relief from the pain, reducing bleeding, reducing the tumor size. So I am looking forward to use it at Sahyadri hospitals, and I am very happy that we have come up with the Indian version of this machine.
In appropriately selected patients, it usually takes about 1 or 2 short treatments under local anesthesia for achieving good tumor management. In case of larger tumors, more sessions can be necessary.
Head and neck cancer is one of the most common cancers in India, and because of lack of awareness in our population, many patients present with advanced stage to a cancer hospital. So in such cases, many patients are amenable to curative treatment. However, few of them also need to undergo palliative treatment, and that there is no curative treatment available for them. Many of them have a fungating wound, pain, bleeding and infection or pus coming out of it. In such cases, in select scenarios, electrochemotherapy comes very handy and is a very useful procedure. This treatment we have used in few of the patients on an experimental basis, and we have found very promising results out of it. There is significant reduction in pain, bleeding, pus discharge in these patients.
Electrochemotherapy device is useful in mainly head and neck cancer patients, oral cavity cancer patients who are suffering a lot of side effects of radiotherapy and chemotherapy. These patients have poor prognosis and their cancer may recur within 1 or 2 years. In such cases, electrochemotherapy device is very beneficial, as this device helps them to minimize the dose of chemotherapy and at the same time to give effective treatment of chemotherapy.
Electrochemotherapy is a cost-effective short treatment which will bring hope to lakhs of patients who have to endure a lot of suffering in the absence of treatment options. This Rotary Global Grant marks an important step towards ensuring a better reach for this advanced therapy.